phenomenon called body voltage, and I think I don't have to go into this, probably explained in another part of the video. We have people have to get rid of their cordless phones, because the cordless phones broadcast a signal 24 hours a day into the rooms wherever the person can walk and have reception. That is a very devastating radiation that was also tested in this Greek study that I just mentioned. It destroys the same number of proteins that the incoming cell phone radiation does from the outside, the cordless phone at home. So since 6 or 7 years, my patients are not allowed to have a cordless phone in the house. They have to go to Radio Shack, spend $25 for a corded phone, and that solves it. Then the last step that we do, that every patient gets to measure with the instrument from Gigahertz Solutions that we use, measure the density of microwave radiation in the bed location. That's measured in microwatts per square meter. And if that number, for me, if the number is over 5, it's an unacceptable sleeping location. First of all, we look in the house. If you find a location, there's eddies, we call that. There's turbulences created in the house where often you find a location where the reading is low. If you don't, the person need to use protection in the house. And there's 2 ways of doing that. One is a wall paint that contains graphite fiber, carbon fiber, and conductive particles that creates a Faraday cage in the bedroom. It's a pitch black paint that's put over other paint, and over that you can paint normal paint, and then that paint itself has to be grounded with a wire into the earth. And the windows are covered with curtains that use a silver-coated cloth that reflects the incoming cell phone radiation to the outside. And with that, in general, it's possible. Every place that we've looked at so far to bring the radiation down to the level where it's acceptable. Now, I want to roll this forward to the clinical picture. Half my practice is the treatment of autistic children. And we realized very quickly when we did this that there's 2 kinds of autistic kids, the ones that recover and the ones that don't recover. And the ones that recover are the ones that follow exactly this set of